Well, thank you, everybody. It's an honor and a privilege to be here to provide some information about what we do at NIH. And, you know, we talk a lot about evidence-based medicine and the continuum of evidence-based medicine. We are the evidence generators, and so we're here to sort of talk about what we know about maternal nutrition. Congressman McGovern, it's good to see you again. This is apropos of our meeting last time when we talked about the B24 project, which was a collaboration between the Department of Health and Human Services and USDA to look at the evidence to include infants and children in dietary guidelines for Americans. We are now moving to include a much more comprehensive approach to pregnancy and women's health and lactation in the dietary guidelines. So what I'd like to talk to you a little bit today is just an outline. What's the problem? What's the prevalence? What are the health consequences? And maybe some solutions that we might think about. So in terms of nutritional health, Congressman McGovern did mention that this is a global problem, and indeed it is. We have an increased recognition domestically and globally of the importance of nutrition and maternal and child health, the so-called 1,000 days, which includes pregnancy and the first 2 years of life. There's an increasing understanding of the role of nutrition in cognitive and behavioral development, which is a critical piece for kids as they grow older and can acquire the skills that they're needed to be productive. The colliding epidemics of infection and non-communicable diseases is a critically important area that we're hoping to address. That is, you know, in areas where we have infection, the United States or elsewhere, we also have non-communicable diseases, and how do we deal with both at the same time in the same population, oftentimes in the same individual? What's the impact of exposure to the environment? This is a critical issue, and it's becoming more so all the time. And then the emerging new paradigms, these are important. They sound sort of esoteric, but they're really not. They are critical to our understanding of how the biology works, how we process the food we eat, and things like the microbiome, the gastrointestinal environment, the ecology of the environment is becoming much more pervasive in our understanding of human biology. Again, here's some additional points with regard to the global prevalence. 2 out of every 3 overweight and obese people live in low middle income countries. So it's not just limited to the United States and Europe, it's an exploding epidemic. Under and overnutrition, as Congressman McGovern noted, is a huge economic burden and needs to be addressed. And it happens, this dual burden of over and undernutrition is something I'm going to talk about a little bit today, but it happens in the same individuals as well as in populations. Here's some evidence with regard to current prevalence of obesity, underweight and overweight in the United States. This is 2011 data from our friends at CDC. You can see the focus on overweight. That is an alarming number. This is pre-pregnancy. This doesn't include the additional weight that goes on during pregnancy and the impact of after pregnancy and losing that weight. Here we see the prevalence of anemia in these populations, and you can see it's not just a problem across the board, but there are very unique pockets. It's a health disparity issue, and as is the weight issue. We're focusing a lot on overweight. It's important, but let's not lose sight of the fact that underweight still exists. It's still highly prevalent. It still impacts on thousands, if not millions of kids, certainly domestically and internationally, and it has consequences. So an underweight woman is more likely to have poor weight gain during pregnancy, low birth weight, preterm births, and full-term births of low birth weight infants. These are some nutritional insufficiencies with regard to the micronutrient issue. And again, we have a health disparity issue here. Non-Hispanic blacks, Mexican Americans had higher rates of vitamin D deficiency. We're learning a lot more about this nutrient. It's a critical nutrient to health, and we tend to think about vitamin D only in terms of rickets and bone health, but it's much more than that. And the more we learn about it, the more we understand that this is a significant public health issue that needs to be addressed. Young women of reproductive age have a higher levels of iodine deficiency. Iodine deficiency, which we thought was addressed by iodizing salt and such, it is a problem in the United States, and it's becoming a bigger problem. And it may have to do with the fact that most of the salt in processed foods is not iodized. Iodine deficiency continues to be the leading cause of mental retardation globally. Non-Hispanic blacks and Mexican Americans of childbearing age are at higher risk for iron deficiency. And just a note at the bottom, again, the success story with folate is undeniable. We've had, as we learned from Dr. Boyle, this is a tremendous success story, and it's an exemplar of how we might think about doing things in the future. So why does it matter? With regard to obesity, well, let's not lose sight of the fact, and I'm sure we won't, many of you in this room won't, the impact of obesity on women's health, independent of their reproductive status, is significant, and women are at high risk for obesity. It's a significant problem. It puts them at high risk for all of the non-communicable diseases. It puts them at high risk for low back pain and osteoarthritis. It puts them at higher risk for both ineffective use of contraceptive and poor fertility outcomes. It increases the rates of cesarean sections and high-risk births, as we've heard. There's an association between obesity and depression that's been reported. There's higher risk of multiple cancers associated with it. So obesity is a problem for women, period. It's a problem for all of us. With regard to preconceptional health, the effects of obesity on pregnancy and pregnancy outcomes, recent studies have shown that pre-pregnancy underweight increases the risk of small for gestational age, low birth weight, and preterm births. Pre-pregnancy overweight associated with increased risk for large for gestational age. That presents problems during delivery. It presents problems in terms of high birth weight, so the baby comes out bigger, has problems losing weight, and macrosomia, which is actually that's needs to be corrected. It's just, macrosomia is a term that refers to a very large baby. And subsequent offspring of mothers who are overweight are larger. So that may have to do with the metabolic problems, the biology of what's going on in the mother. It may have to do with her inability to lose weight between pregnancies, the inter-pregnancy period. It may be a lot of things. It's an area of research that we need to explore, but what we do know is that it's a risk factor. So what's the impact of maternal body composition on other things? Well, this is a really important thing, going back to that issue of cognitive and behavioral development. We've got data that indicates that compared with children of normal weight, mental health scores among children of mothers who are obese or overweight are significantly worse. They're at higher risk for poor mental outcomes. Similarly, children of underweight moms are also at increased risk. So at either end of the spectrum, we've got a problem, and that needs to be attended to. The mechanisms, it's not clear. There's lots of possible, plausible mechanisms to explain that, but the fact of the matter is that it's a problem. The authors of this large study concluded that there's no question it's a problem. I want to just briefly mention the issue of long-term implications of poor birth outcomes in the intrauterine environment. There's what we call the Barker hypothesis, which was named after an investigator in England, David Barker, who did some epidemiology a number of years ago and saw an association between low birth weight and poor long-term outcomes. He looked at birth cohorts and looked at them 20, 30, 40 years down the road and saw a high association between low birth weight and various adverse health outcomes. We've now learned that there's a higher risk for obesity, higher risk for cardiovascular risk, higher risk for diabetes, perhaps a higher risk in cancer of children who are low birth weight and have the kinds of birth problems we're talking about in mothers who have aberrant weight problems during pregnancy. It's an important area of research. The developmental origins of health and disease is a focal point at NIH and around the globe for research. Over and under nutrition, again, this dual burden of over and under nutrition. It's not just being overweight. It's not just eating too much. The fact that you're overweight causes all sorts of problems. The quality of your diet may indeed be affected, may be indeed playing a role, but the metabolic consequences of being overweight has consequences. So analysis of NHANES data show that iron status is significantly affected. The more overweight you are, the worse your iron status. In a study in Mexico, this was a large cohort study, and they looked very closely at this issue of anemia and iron deficiency because it's a big problem in countries like Mexico, but the biology is the same. And so when you have a study of this size, it's an important thing to pay attention to. And they found that there were significant problems with iron associated with weight. And one of the issues that it was associated with was a chemical, a compound that circulates in the blood that reflects the inflammatory process. It's called CRP, C-reactive protein. When you have a high level of CRP, it indicates that you're inflamed. Obesity is an inflammatory condition. It has an impact, inflammation has an impact on a lot of systems, and what we're learning is that it impacts on our ability to assess nutritional status. It also has an impact on nutritional status. So it's a very important issue. Obesity is an inflammatory condition. It leads to other inflammatory conditions. It also leads to nutrient insufficiencies and problems. The other nutrient that's really important to pay attention to, again, is the vitamin D issue. And again, here's another study that showed that vitamin D becomes a problem in obesity as well. Vitamin D is a critical issue. As I mentioned earlier, it's becoming more and more critical. I'm not going to spend a lot of time on this, but just note that there's a dose response between pre-pregnancy BMI and vitamin D deficiency. So again, the more overweight you are, the worse your vitamin D status is. That's going to impact on your bone health, and it's going to impact on your cardiovascular health, it's going to impact on your ability to fight infections. And it's going to impact on your ability to provide vitamin D to your child. So how do we deal with these issues? Clearly, as noted by Dr. Boyle, this is going to be a very these are complicated questions that are going to require a multidisciplinary approach. There are health outcomes that we have to learn more about. We have to learn more about the environment, and I don't just mean the toxins in the environment, I mean the social behavioral context, issues related to cultural practices. We've had meetings at NIH where we brought members of different underserved populations and asked them, we presented the science to them, and then said, what messages will resonate with you? Would it help if we had a message that you should increase your exercise? And people in inner city Baltimore tell us, well, we can't go out. So that message doesn't mean anything to us. It's hard for us to go out. A Native American population will tell us that culturally a high body mass index is desirable. How do we overcome those kinds of issues? We have to be attentive to those issues and understand the context that women live in. And obviously the issue of diet and nutrition is going to be important in all this. How do we define a quality diet? How do we get the message out about what's a quality diet? And how do we provide access to, how do we deal with the issue of food security? I know this is an important issue for Congressman McGovern. We've talked about the issue of food insecurity. It's a really important problem. It's an important problem in terms of the access to an available high-quality diet, but the built environment is also important. How do you get to that high-quality diet? This is just an example of a study that was done in Pennsylvania. It was a large community-based study, and they did a behavioral intervention to see if they can have an impact on women's health, and they did. They found that they were able to increase the use of multivitamins, including folic acid. They found that lower weight and body mass index, so that women were responding in terms of quality of diet. They had a lower average pregnancy weight gain compared with the control group. So here's an intervention that was a behaviorally based, community-based intervention that worked. So there are things that we can do. We also have lots of evidence with regard to the impact of using specific nutrient to improve the quality of diets, either through supplementation, food fortification, as we talked about. So there are lots of ways that we can do this. It's a daunting problem, but we should not be daunted by it. We should continue to move forward, and we need to learn more about how to measure things in people so we can really document what the problem is. So biomarkers to measure things are really important, and we need to learn more about what the best kinds of interventions are in the context where people live. This is just a cartoon that sort of lays out a research agenda for us, and I thought it might be interesting for you. If you look at the bottom, it goes from pre-pregnancy to the end of life. And this accounts for all the things that are going on in the population, in the community. And in the middle, I put inflammation and the microbiome as possible mediating effects. These are areas of active exploration that need to be further explored. NIH has been doing a tremendous job with regard to learning the microbiome, characterizing the microbiome, and it's important to human health. Again, the role of inflammation, as I mentioned earlier, is critical because it's a part of every one of these things. The issue of the nutrition transition, you may have heard a little bit about that today on WTOP. There's a new study, I understand, that's being rolled out to look at the impact of changes in the diet from traditional diets to the diets that we now all use and live by, whether it's fast food, processed foods, or whatever. That's had an impact on us. It's had a significant impact on us, and we're now documenting that impact. In the international community, this nutrition transition is becoming a huge contributor to the problems that we talked about earlier in terms of the prevalence of both over and under and the dual burden. So I think that's it. I'm going to end it here, and I thank you for your time.